Hey friends, I'm so glad you found me. I'm Stephanie Carter Kelley, a physical therapist who uses yoga in just about everything I do. Today we're going to talk about knee pain, and I'm going to give you the magic pill that you need to relieve knee pain. So as a physical therapist, I cannot prescribe medication. But what I can give you are small doses of exercise that make you feel better immediately. I've developed these magic pills from my yoga classes, where in the class, I lead people through a little bit of activity, they see how it feels, and then I give them that small dose. Activating muscles or a little bit of extra range of motion. Maybe it's a self-mobility practice, and then we see how it feels. And many times, I see just the relief in people's faces that they feel immediate relief just from little tiny bits of exercise. But like all medication, it has to be the right dose at the right time for the right person. And sometimes you need a little bit of trial and error for that. But today we're going to focus on knee pain. And really specifically pain that's right in the front of the knee, maybe around the kneecap. What we might call anterior knee pain or patellofemoral pain. And one of the first things we tend to give in physical therapy is an activation of the muscle. Make sure that muscle really works. So I want you just to sit in what we call a long sitting position with one or both legs outstretched. You can support yourself on your hands. And your goal is to look at your knee, your patella, your kneecap, and also the thigh. And what I want you to do is just tighten your whole thigh. You can kind of see how my whole thigh tightens. And when I do that, my kneecap moves up a little bit. I'm exaggerating here, but it moves up a little bit into my thighs. Now, some of you may have a gap here. That's okay. If you want to put a towel roll here, you can press into the towel roll so that you can see that quadriceps muscle contract and the patella draw up. Others of you might have some hyper mobility in the knee. Maybe you extend your knee quite a bit. You could raise your ankle so that you can get that full effect and get that locking of your knee. You want to get full motion of that knee, even if it goes into a tad bit of, beyond straight or what we call hyperextension. That's okay. You can keep the toes pulled back a little bit and just tighten and release. Tighten and release. Tighten and release. So maybe it's just one knee that bothers you, but you could do this on both knees, alternating or doing them at the same time. It really doesn't matter. It's all about tighten and release. And trying to really localize it just to the quad. You don't want to feel your butt squeezing, your glutes squeezing, or your thighs clenching together. You just want to localize it right here, right on the top of your thigh. Tighten and release, tighten and release. So if we want that muscle to eventually get stronger, it has to activate. So muscle activation is the first thing that we really have to go for in order to progress through any type of exercise program. Tighten and release. So if we're going to progress it, we're going to progress this a little bit. So you've got what we call quad set, or that tightening of the quadriceps, moving of the patella. We're going to stick to this left leg. Now it's nice and straight. So you're going to tighten it without looking at it now. Tighten it. And then pull the toes back. Engage your core and lift that leg. And keep it nice and straight and just hold it. Feel that quad really tightening, that kneecap pulling up. And then set it down. Keep your core engaged as you set that leg down. And then fully relax. And now engage the core, pull the toes back, tighten the top of the thigh, set that quad. My heel lifts up a little bit as I do that. It's okay. And then lift that leg again. Hold it. Take a nice big breath. And relax. And then keep your core engaged, set that leg down. And you can repeat.
Tighten the core, push that back flat down, protect your back, pull the toes back, tighten the thigh, lift. Nice big breath, hold it, let it out, squeeze your core, squeeze the thigh, let that leg down. So there's a little bit more involved in order to do what we call a straight leg raise. Quad set, progressing into the straight leg raise. Kind of a combination of exercises, small dosage of exercise that will make that knee feel better immediately. But if this doesn't work for you, or if you feel like you're ready to progress beyond this, then I would say find a physical therapist. You can go to the American Physical Therapy Association, and they have a search function called Find a PT. So go there, find a good physical therapist in your area to progress you along. Or if this didn't work for you, then you haven't got the right pill. You need to change the exercise or that dosage to find the right one. And you need a physical therapist to guide you through that process. So if you like this and you want to share it, feel free to share it to friends. You can tap on the bell or subscribe to my channel to get more little bits of exercise and knowledge that empowers you to live a better life without pain. I'm Stephanie Carter Kelley, physical therapist, yoga teacher. Namaste.